All right, I want to welcome everyone to the first of the four-part series on mental health and wellness put on by the Health and Wellness Committee for the Business Law section of the Florida Bar. Each installment will be presented quarterly at noon via Zoom, each designed to raise awareness about various mental health issues faced by lawyers. The rise in mental health crises in general and in the legal profession specifically is well documented. I will not repeat those statistics here. However, there are many resources available to help. In addition to this series, the Business Law section is presenting. The Florida Bar has many resources, including a helpline and recovery assistance. Just type in mental health on the Florida Bar website, and you will find the resource page. This series will be led by two licensed mental health counselors. Each part will vary in substance, and each part is intended to build off one another. Today's program will address identifying acute mental health crises, such as suicide, self-harm, and substance abuse, and avenues for help. Part 2 will address skills and strategies for handling everyday stress. Part 3 will focus on recognizing mental health issues in those around us, focusing on fellow attorneys, but also others in our lives, tools for de-escalating difficult situations, and knowing when to report and how to ethically do so. The final part will address dealing with difficult clients, secondary trauma, tools for separating yourself and drawing good boundaries, knowing when to report, and how to ethically do so. Each presentation is open to all members of the Florida Bar and is free for Business Law section members. The course number for the CLE credit is in the chat. Look for emails from the Business Law section for information about the dates for future installments, how to access the materials, and the CLE course numbers. We will hear from our speakers, who I would introduce shortly, and then leave about 10 minutes at the end for questions and answers. Please put your questions in the chat, and we will get to as many questions as we can. Now let me introduce our speakers. First, for those of you who don't know me, I'm Laurel Isikoff. I am the Chief Bankruptcy Judge for the Southern District of Florida. Luckily for you, my speaking part is done. Dr. Kristen Jones is a licensed mental health counselor practicing in Miami, Florida. She holds a doctoral degree in health science, a master's degree in mental health counseling, and a bachelor's degree in psychology. She specializes in the treatment of eating disorders, anxiety disorders, borderline personality disorder, and post-traumatic stress disorder. Dr. Jones is also the founder of Jones Mindful Living, a virtual emotional wellness program that serves people globally. Dahlia McDonald is a licensed mental health counselor. Throughout her career, Dahlia has specialized in treating pervasive emotion dysregulation and high-risk behaviors such as self-harm and chronic suicidality, borderline personality disorder, obsessive-compulsive disorder, acute anxiety, depression, and eating disorders. She has also provided intensive executive function skills training for those with attention deficit hyperactivity disorder. In addition, Dahlia has advised groups in various organizations and academic institutions on using strategies for personal, academic, and professional development. I will now turn it over to Dr. Jones. Thank you.
Thank you, Judge, and thank you everyone for being here. Dahlia and I are both so honored to be here and to present this very important topic. There we go, got the slides working. So today, this is just an overview of what we will be discussing. We'll be talking about just some basic information, some basic statistics about mental health in law. We're going to talk about identifying serious mental health problems, concerning symptoms, and when you should go reach out for help and how to do so. We're also going to talk about how to identify an emotional crisis, and we're going to teach you some very effective, simple to use crisis survival skills that you can use when you are experiencing that intense distress. So let's start out just by talking about mental health and why it matters. So as many of you know, mental health problems are a growing concern in the country and worldwide. And they not only impact the person who is experiencing the difficulty, they really have an impact that permeates beyond that person. They impact physical health, career performance, family life, relationships, and beyond. And these problems can not only cause the person to experience difficult, just an overall well-being, but they can become downright life-threatening and dangerous. And studies have found that mental health problems are pervasive and prevalent in the legal profession. So I'm going to talk about just a couple of studies, just some basic statistics, just to get a sense of where mental health is in law. So in one study, they found that 28% of practicing lawyers experienced depression within the year. And that number was up to 48% during the scope of their legal career. So that is a really high number. Problematic drinking is also a challenge in the legal profession, with 20% of practicing attorneys experiencing problematic drinking. And that's in comparison to 11.8% in the highly educated workforce. 19% of practicing attorneys experience anxiety, and up to 61% experience anxiety at some point in their legal career. So again, that is a huge number, over half of lawyers. And for me, the most alarming statistic here was that 11.5% of lawyers experience suicidal thoughts during their legal career. And 0.7% had at least one attempt. So that number is very high. You know, almost 1% of practicing attorneys had at least one suicide attempt. So this is a very serious problem. Dahlia is going to talk to us more about the problem of suicidality shortly. And just here's another study. Again, we found a high linking to anxiety and depression in the legal profession. And one thing about this study that was interesting is that women were experiencing worse mental health challenges than men, and more problematic drinking. And a lot of that is probably linked to the extra pressures that women face as far as career and also managing life and family and all of those challenges. Another statistic too was that 25% of women and 17% of men contemplated leaving the legal profession due to mental health challenges. So that is significant. And as we're going to talk about today, many mental health challenges are treatable. There are people who are specially trained in all of the different challenges that we are going to discuss today. So treatment is possible, help is out there. So we want to really encourage people to seek help when it's needed.
So in this next section, excuse me, we're going to cover some of the more common mental health challenges. And these include anxiety, depression, suicidal ideation, self-harm, substance use, and eating disorders. And as we go through these, it's important to remember that being mentally healthy does not mean feeling happy and relaxed all the time, as nice as that might sound. What it means is having appropriate emotions for situations and being able to manage those feelings effectively. So feeling nervous, sad, irritable, those are all actually healthy ways to feel depending on the context. The problems tend to arise when people use unhealthy ways to cope, where they get stuck in ongoing psychological distress. So on the next slide, we're going to discuss anxiety. And anxiety is our emotional alarm system. So it feels like a tense, unpleasant sense of apprehension and comes from your mind anticipating possible danger. It's actually pretty important because it warns us that something could be wrong, and it's what motivates us to protect ourselves. So issues with anxiety become problematic when the anxious reaction becomes much more intense than what would normally make sense. And we can start to feel anxious and fearful when there's really no danger at all, or if the threat is really small. When people struggle with anxiety, it can be extremely uncomfortable. And it's like an ominous sense that danger is pending and that there's a threat looming, and this feeling might not really go away, or you find yourself using unhealthy or damaging coping skills to manage the anxiety, which can be very disruptive to day-to-day life. And some of the symptoms, as you can see on the slide, include feeling nervous, emotionally activated, and restless. There are also some physiological symptoms such as muscular tension, increased heart rate, sweating, and trembling. And it's important to seek help when you notice a destructive pattern of behavior being used and relied upon to manage anxiety. And examples of this can be avoidance, withdrawal, and using substances to self-medicate. In regard to depression, everyone has ups and downs, and that's just a part of life that we can't escape. However, if you're feeling persistent sadness day after day, there's probably something more serious going on. Depression is a mood disorder characterized by sadness, hopelessness, lack of motivation, loss of interest in activities that were once pleasurable, and so on, as you can see from the long list of symptoms. And I'd like to highlight this last bullet about frequent or recurrent thoughts of death, which I'll elaborate on shortly. Suicidal ideation is common during depression and a huge red flag. Sorry, we're actually still on the previous one. So suicidal ideation is common with depression, but in the moment you notice thoughts of suicide, this isn't a gray area. It is imperative that you reach out for help at that time. Another major concern with depression is that it affects the way you think, feel, and behave, probably more so than most people are aware of. And this is what ties into the next slide with the brain scans. So these images are PET scans showing the brain activity of someone that's depressed and someone that is considered to have normal neurological functioning. The white and yellow areas are regions of high brain activity. So the image on the left shows drastically how different the depressed mind can look from someone who's not struggling with depression. And the less brain activity, the less mental acuity you're working with, and which obviously interferes with daily living and normal activities. So this really goes for both anxiety and depression, even though this study specifically looked at depression, and these scans relate to that. Our emotional states can activate and deactivate the various regions of the brain, which in turn directly impacts our ability to perform. So that is something important to keep in mind. On the next slide, so suicidal thoughts and self-harm. While thinking about ending one's life or harming oneself tends to be common with depression, it can also happen outside of the realm of depression and with other emotional disorders. So suicidal ideation includes thoughts and ideas about ending one's life. And there are two categories of ideation. We have passive suicidal ideation, which is more common, and it's having the desire to die, but not having a plan per se. And in active suicidal ideation, you have the desire, but you also have a plan. And in this stage, people may already begin trying to get their affairs in order, or they're preparing to take their own life. And both, while the second one sounds more serious, both stages are extremely dangerous and need to be taken seriously. It is important to try to get immediate help if you find yourself thinking about suicide at all. When people experience suicidality, they're often experiencing tunnel vision, where they take those thoughts and feelings as truth, and they have a hard time seeing life beyond what they're feeling. So that's really why getting professional help is so important, because that objective perspective that a clinician can provide can help the individual see beyond those beliefs, seeing beyond the hopelessness and feeling like life is not worth living, and gives the professional an opportunity to instill a sense of hope. In terms of self-harm, it's an act of intentionally harming yourself, but it's usually a form of coping without the intention to take your life. And some common examples include cutting, burning, and hitting. The reason we grouped self-harm with suicidal ideation is because the research shows that there is an increased risk for suicide with self-harming behavior. So in the type of therapy that Kristen and I do, we consider both self-harm and suicidal ideation to be life-threatening behaviors, and they are the top priority when working with someone because they are that dangerous. In terms of when to get help, some things to look for are feeling hopelessness and feeling like you're a burden to others, feeling overwhelmed by sadness and pain, substance use and risky behaviors, social withdrawal and isolation, extreme mood swings, and highly reactive behavior. I know we sound a little bit like a broken record, but the moment you have thoughts of suicide or of harming yourself is the moment you need to reach out for help, or we would like you to reach out for help. There are certain professionals, just to keep in mind, that are more experienced with self-harm and suicidality, like anyone trained in dialectical behavior therapy. So it's important to find someone with experience in these areas so they can provide some effective skills to target self-injurious behaviors and suicidal tendencies. So substance use disorders are characterized by the continued use of a substance and inability to stop despite physical, social, professional, and emotional problems. These substances tend to be harmful in nature, and people become consumed with trying to get the substance, to use it, and to recover from it. And this can it generally causes a lot of problems and can completely disrupt an individual's family, their career, their finances. As you can see here, some other symptoms to be aware of are denial of there being a problem, changes in mood, appetite and sleep, engaging in risky behaviors, legal problems, and losing interest in things that were once pleasurable. And with addiction disorders, I want to point out that these disorders are generally a person's way of coping with some underlying psychological distress, and that getting the person to abstain from their addiction is only the first part of the therapeutic process and is just scratching the surface. So when to get help, some things that you want to look for are distress related to the substance. Maintaining an addiction generally causes a lot of problems, as I mentioned before, so there will be a significant amount of difficulty associated with managing the habit. Life begins to revolve around the use of the substance. They build a tolerance and have withdrawal symptoms, which can be extremely unpleasant. So generally people will pick right back up and start using immediately after to avoid the discomfort of withdrawal. If someone is using alcohol or drugs or has an addiction to other things like sex, gambling, or shopping, and there are negative consequences to one or multiple areas of their life, find someone who specializes in addiction to get the necessary help and to get an evaluation. Eating disorders are characterized by persistent eating disturbances, such as eating very little, no interest in or avoidance of food to the point of significant weight loss, having an overwhelming fear of gaining weight, the inability to maintain normal body weight, and even having a distorted perception of the shape and size of their body. And some people, in addition to the restricting, will also eat meals or binge on large quantities of food and then compensate with induced vomiting, diuretics, and excessive working out. If you find that food, body weight gain or extreme fear of unhealthy eating are consuming your life, this is generally the red flag and the cause for concern. Something that might start out as a diet and trying to get healthier can very quickly spiral and end up as something highly dysfunctional and disordered. And unfortunately, we live in a society where a lot of disordered eating habits are socially acceptable. So there may be a lot of ambiguity over what's healthy versus what's considered disordered behavior. So it is important to refer to a healthcare professional just to see what their opinion is, because what you might be doing is in fact unhealthy. In general, if you suspect that there's a problem, there tends to be something that's underlying the issue, something else going on. So another thing I'd like to note is that even though most people consider eating disorders to be primarily common in women, many men also struggle with disordered eating and body distortion. It's just that men don't tend to seek out help as frequently as women. And then we wanted to share with you some other symptoms that can be red flags and can alert you so that you can reach out for help. Many of these are part of other disorders, but it can be helpful to recognize that these may be signs of an underlying emotional problem. For example, when there is sudden change to mood, sleep, or behavior, that should be a warning. In terms of disturbing and intrusive thoughts, our minds tend to generate worst case scenarios all the time. And thinking about disturbing things is not entirely unusual for some people. However, you should be cautious when these thoughts become consuming and cause a high level of distress. This is the same for obsessive compulsive behaviors, extreme self-criticism and perfectionism, the sense that you're losing touch with reality, risky and impulsive behaviors, and paranoia. When it causes a lot of distress and it's more frequent than you might like, reach out for help. And just so everyone's aware, there are treatment modalities for everything we just discussed. And if you catch these problems earlier than later, when these disorders are in the mild to moderate range, they are significantly easier to treat. The biggest problems I see are when these disorders go untreated because people are either trying to work through them on their own, minimizing the severity of the condition, or in denial that they have a problem to begin with. And people's lives begin to deteriorate as a result of not receiving the help they need. So if you think you're struggling emotionally, please seek out professional help. We've listed the resources on the next slide. You have the Suicide and Crisis Lifeline. So if at any point, like I said a million times at this point, if you're thinking about suicide or ending your life in self-harm, reach out. You can contact 988 24 hours a day, 7 days a week to speak with a mental health professional. You can also contact your insurance provider to see who they have on your plan that's in network, and they will give you a list of mental health professionals along with psychiatrists. You can reach out to, you can look at the various directories like Psychology Today, Theravive, Good Therapy, and Zen Care to see who's available in your area. BetterHelp is known for having a lot of reasonable and affordable telehealth options. And then lastly, if you are in a crisis, which Kristen is going to discuss more specifically, if you're in a crisis, call 911 or reach out to a local emergency room.
Thank you, Dahlia. So we just discussed, or Dahlia just discussed, a number of different serious mental health challenges. And any of these, and even in the absence really of those disorders that she mentioned, people can experience a mental health crisis. So what we wanted to talk to you about today is some skills that can equip you with tools to make it through one of those crises. So let's first start out by talking about what is a crisis in general, because it's different than general emotion dysregulation or feeling a painful emotion. So a crisis situation is one that is highly stressful. It's something that's short term. So if you're in a situation where there's ongoing emotional trouble, this isn't a crisis. A crisis is short term. It tends to bring up intense emotion that really overwhelms you. Along with that comes a sense of urgency and a need to resolve the crisis right now. So that may involve, using some kind of destructive coping mechanism, some way to alleviate that distress. And so the skills that we're going to talk about today are helpful, healthy ways that you can bring down that intensity that won't cause negative consequences and make things worse. So a crisis is different from regular emotion dysregulation, primarily in the level of intensity and also that sense of urgency. So with a crisis, there tends to be kind of a desperate, urgent desire to alleviate that pain. And also with that dysregulation, because of that high level of emotion dysregulation, high level of emotional overwhelm, there tends to be a lot of difficulty accessing the part of the brain that's responsible for logical thought, the part of the brain that allows you to problem solve, to recognize consequences. And there tends to be a difficulty with functioning well and completing basic responsibilities. So functioning in work, taking care of your kids, driving to the airport, doing basic tasks. So these skills that we're going to teach you are effective ways that you can tolerate those very painful situations, urges, and emotions. But these skills are not for everyday challenges. So these are kind of like your quick fix, like 911 first aid, like the title, first aid skills. These aren't the skills for everyday emotional challenges and regulation. So we want to use the skills that I'm about to teach you when that emotional intensity that you're feeling, that emotional pain is so strong and it can't be resolved right away. We want to use this when there's a strong urgency to act on emotions, especially in ways that could make the situation worse in the short term or the long term. We want to use skills like these when we're overwhelmed and we need to stay regulated, like when we need to function and fulfill our responsibilities. And we can use these when the intensity is extreme, but the problems can't be resolved immediately. So these are skills that are going to help to bring that intensity down so that you can then function. But these skills are not for everything, as I said before. We don't want to use these skills for every low to moderate emotional situation. We don't want to use these for everyday crisis. In dialectical behavior therapy, the kind of treatment that Dahlia and I specialize in, we have a number of skills, a number of emotion regulation skills that are very helpful with, in dealing with low to moderate emotional intensity, with kind of everyday problem solving, with creating a meaningful life. But, these crisis survival skills are not for that. They're not for solving your life's problems, and they're not for creating a meaningful life. However, having the tools in your tool belt to deal with a high level of distress can be part of creating a life that feels more meaningful, that feels more fulfilling, and they can be very important to reduce those negative consequences that may interfere with the things that really matter to you in your life. So, most people experience some kind of mental health crisis or emotional crisis, a high level of distress at some point in their lives. And these skills can be so helpful, as we're going to talk about. It's a red flag, though, if you find yourself consistently encountering crisis situations. So if you are repeatedly experiencing crisis situations, you feel like you're always kind of putting out a fire or, quote unquote, white knuckling it through life, there's probably something else going on in your life that really needs to be looked at and tended to. So there may be some unresolved emotion or grief. There may be unresolved trauma that needs to be dealt with and healed. There may be a life situation that really needs to be dealt with. And unless it is, that crisis is going to continuously repeat. There may be difficulty accepting reality. So if there's something in your life that you're having a hard time really accepting, that it's part of your life, that it is the reality, that can be something to really look at. And finally, if a crisis keeps coming up, there may be something in your life that needs some really focused problem solving. So now we're going to get into these skills. And again, these skills that I'm about to teach are part of the distress tolerance skills that we teach in dialectical behavior therapy. And a few things to keep in mind with this. So the goal of these skills, as I've said before, I might say again, is to make it through the distress without making things worse, with short-term or long-term consequences. But the most important thing to do, and really the most effective way to start using these, is to cope ahead for those distressing situations. So I'm going to teach you a number of skills. But I encourage you not to wait until the next time you experience distress to use those skills. One of the most effective strategies that we can do is to create a plan. In DBT, we call this coping ahead, to create a plan for the skills and the strategies that you will use the next time you do experience that emotional overwhelm. And then what we want to do is mentally rehearse that plan before that distress happens. And we want to do this the same way that we would mentally rehearse a presentation. If somebody is in trial, you'd mentally rehearse what you're going to say. Athletes do this before they have a competition. So when we mentally rehearse, it actually activates the brain in a similar way as if we were to do it in real life. So mental rehearsing is real rehearsing. And when we do that, then when the distress happens, we are much more likely to be effective and use these skills well. Another important thing to keep in mind if you are experiencing distress is to not judge yourself and not to criticize yourself. Those things tend to kind of put more fuel to the fire. They tend to complicate things. They add more emotions like shame and guilt and anger, and they can just make the situation so much more challenging. And finally, this is not the time to try to figure it out. So if you are experiencing distress, this isn't the time to try to figure out why you are experiencing this. This is a time to make it through and to do what works to make it through that distress. Once you are more emotionally regulated, then you can go back and analyze it or, speak to a professional to try to figure out what is going on. But in that moment, it's about making it through without doing something that's going to make the situation worse. So the first skill that I'd like to share with you is a really important one. This is one of our favorites in DBT. It's called TIP. In DBT, we use a lot of acronyms. I'm going to share with you a few acronyms today, and it can just help you to remember how to use this. So TIP stands for temperature, intense exercise, paced breathing, progressive muscle relaxation. And what this skill is all about is helping to reduce your emotional arousal. So it targets your physiology as a way to bring down emotional intensity. And this can be incredibly helpful when you are just emotionally overwhelmed, overloaded, and you're having a hard time processing information, problem solving, or doing, coping skills that do involve more thought. These skills tend to work pretty quickly. And again, they don't take a lot of thought, but they work directly with your physiology. And the research shows that our emotions have a very strong physiological component. In fact, some people say that we are about 80% physiological, 20% psychological. So that physiology really has a huge impact. So we shift the physiology and we shift the emotion. So an important and really easy kind of 911 skill, quick skill that you can use is using cold. So cold, especially when it's applied to the face, can very quickly reduce your heartbeat. And when doing that, it helps to shift the physiology and reduce that emotional intensity. So a great way to do this is through ice. I think that there's been kind of more talk about using ice, but there are a number of ways that you can do it. So kind of the classic way to use this is an ice dive, which is where you fill up a bowl of water with ice water, and you take a deep breath, and then you plunge your head into the water, and you hold your breath as long as you can, and then you come up and you do that several times. Now, some of you may be thinking, when I'm in distress, that takes a lot of work. That sounds very complicated. So there's some other things that you can do. One is to have some ice packs available to you in your freezer, and you can take them, you can hold them, you can put them on your face and your neck. Sometimes just even holding them in your hands can help. And then there's another option, which is these breakable ice packs that you can buy at any CVS or Walgreens. You can get them in the first aid section, and you can generally break them or twist them and they become cold immediately. And these are things I encourage clients to put them in their bags, to carry them around, especially if you're encountering a situation where you think that distress could happen. For example, if you have a fear of flying and you're about to get on a flight, having that ice pack can be really helpful. You can also just, splash cold water in your face too. So those of you who may not like ice, or those of you who have heart problems, you can also use hot water. So get in, the shower, hot water, that can also help as well. So when it comes to ice, I just want to put out a disclaimer that you do need to exercise caution if you do have any kind of health conditions, especially heart conditions. So if you have a heart condition or a medical condition, if you take beta blockers, which reduce your heart rate, or have an eating disorder, it's important that you talk to your doctor first before you use ice. So the next part of tip is intense exercise. So again, what this does is it changes the physiology. And this is, by intense exercise, this is different than just a stroll around the block, which can also be really helpful for stress or maybe kind of everyday emotional challenges. But when we're talking about a high level of distress, intense exercise can be really helpful in shifting that physiology. So you can do this for 10 to 30 minutes. It can take many different forms, doing jumping jacks, sprinting around the block, getting on a bike, and also a 2-minute burst can help. You just want to be careful that you're not overdoing it and you're really listening to your body. And again, just like with the ice, if there are any kind of health conditions, or if you haven't engaged in exercise before, it's important to get cleared by your doctor before you do so. So the next two involve paced breathing, and breath, just to kind of let you know, is a very powerful tool that we have available to us all the time, 24/7, and it can really help to shift our physiology and help our brain to find safety. So part of when we're experiencing distress is often the brain feels like there is a threat. And so when we breathe, the same with the ice and the intense exercise, which help to shift the physiology, but particularly with the breath too. When we slow down the breath, it helps to slow down the heart. It helps the brain to get the message that I am safe in this moment. So it basically helps us to check in with reality and recognize our safety. And we can do this in a couple of ways. So by paced breathing, I mean that we are systematically breathing in a specific way. So this could just be a slow, steady breath where you're counting your breath. This could be square breath. A lot of people like square breath. So basically that's inhaling for a count of 4, holding for a count of 4, exhaling for a count of 4, and then holding the exhale for a count of 4. So you're basically moving in a square with the breath. Another one that I really like is the 4-6 breath, which is where you're inhaling for a count of 4 and you're exhaling for a count of 6. So by extending the exhale, it helps to reduce the heartbeat quicker. And you can generally do this for a couple of minutes and experience some relief. Progressive muscle relaxation is another way that you can help the body to experience safety and reduce that emotional arousal. And so this is basically tensing and releasing body parts. I find this one to be helpful for people who may have challenges just kind of sitting and breathing, because this is more of a doing. So what you can do is pair this with your breath, starting, for example, at your feet or your legs, and you tense that body part on the inhale. And as you exhale, you release that body part, and you can work from your feet and slowly move all the way up to the crown of your head. Okay, so that works to shift the physiology, which is a big component of emotion in general. Now, another part of emotion is that cognitive part, that thinking about the problem situation that is prompting the emotion. So part of what we need to do to kind of downshift that emotional intensity is to shift our focus away from what is prompting the emotion. And we can do that through distraction. So we have another acronym here, which is ACCEPTS in DBT. And this just helps you to remember ways that you can distract. Now, when we use distraction, this is intentional shifting of focus to something that is not related to what's bringing up the distress. And we need to really go into this all the way. So we can't do distraction activities while still thinking about the thing that's bringing up the distress. We really need to go in all the way, commit and practice willingness to really shift our focus. And we can do this with a number of ways, activities, kind of fully engaging in something. This could be cleaning your house, washing your dishes. This could be organizing. This could be doing a specific task that involves all of your attention. We can do this through contributing. So this is kind of a combination of activities with helping. And, so this one kind of has a dual action to it in that the activity helps to distract, but also we're shifting away from so much self-focus. So when we're experiencing a high level of distress, we're often incredibly self-focused and not in a helpful way. We're focused generally entirely on what I'm thinking, what I'm feeling. And so shifting that attention to someone else can have the benefit too of further reducing that intensity. Another way that we can distract is through opposite emotions. So for example, if you are experiencing a high level of despair, sadness, you could distract by, watching or listening to stand-up comedy or something that's going to be really kind of captivating and bring about a different emotional response. We can also do this through thoughts and certain things like crossword puzzle, Sudoku, even something as simple as looking at a picture and counting all of the red things in the picture. So something like that, where you're really focusing the mind on different things, can help it to stop focusing on the thing that's bringing about the distress and can help to reduce that intensity. And then finally, we have sensation. So this is one that kind of pairs with tip too. That anything that's a very strong sensation can kind of help to shock your brain in a bit and help that the intensity to reduce. So some ways that you can do this: a very sour candy, a very strong mint. One of my favorites is to cut up lemon and put them in your refrigerator and then suck on the lemon when there's distress. And then you get the dual combination of the intense sourness of the lemon and the cold. And those sensations, again, they help to shift and kind of distract the mind from that distress. Another important skill that a lot of people find helpful, and when I'm talking about these, I'm throwing out quite a few, and so I do encourage you to try these out and to not wait until there's a high level of distress to try them out. It can be really helpful to practice these skills when there's kind of a mild to moderate level of distress, just to see how that feels for you, and then you can see which ones tend to work better. But self-soothing is basically mindfully soothing through your senses. And we can do this with any of the 5 senses: sight, smell, taste, touch, sound. Certain people tend to gravitate towards certain senses. In particular, a lot of people tend to be very soothed by smell. So for example, smelling a lavender scent, and that's something simple that you can even carry around with you. It can be really helpful to have some of these tools with you to carry around so that you can use them quickly when it's needed. Scent is one of those. You can also carry around something that's soft, something that's physically soothing. Something like a hot tea can be very soothing for taste as well. But again, you can try out a lot of different things and see what feels soothing to you. But this action can be helpful because it really does help your nervous system to soothe, because part of the distress is the nervous system, is really highly activated, and we need to bring it down, and we need to allow the nervous system to feel safe. And by giving it soothing, it helps to slow it down and it helps it to regulate. This is also an important thing to learn how to do for yourself. Learning how to soothe yourself and not just waiting around for other people can be healing as well. Waiting around for other people to soothe you, or for reaching for something like a maladaptive coping mechanism like a substance to soothe. Learning how to soothe in a way that's not going to lead to those negative consequences is important. And also, you can do these soothing skills in everyday life as a way to balance your nervous system in general. You don't have to just use these during distress. And then we have the improve skills. So this one tends to be really helpful in that it helps to purposefully bring positive into the situation. So it makes that moment more tolerable. Sometimes also I want to note that these skills can all be used in combination. So if the distress is really high, you may need to start with something like tip, follow it up with some distract, and then maybe you move into some of these improve skills. So you can kind of wrap them up and have them to build on each other. But there's different ways that you can use this. For example, meaning. Often people find, during a distressing situation, during a major life challenge, if they can find some kind of meaning in that struggle, it can help to shift the way that we're experiencing that distress. Finding how could this help me to grow? What lesson is there here to learn? Prayer can be very helpful for people, as well as different relaxation techniques. Again, this is helping to make that moment more tolerable. Some other things that can be helpful too is encouragement. I think that this is something that seems so simple, but I think people forget about, is that learning how to be your own support, learning how to be somebody who is your own cheerleader, not just waiting for other people to do that for you, but being that for yourself. And then sometimes taking a vacation. So we all need to hit pause sometimes and go somewhere where we are getting away from it all. So that, sometimes that could be a full-on vacation, but it doesn't have to be. Sometimes it could be as simple as I'm going to pause for 30 minutes and take a vacation from this situation. I'm going to sit here and I'm going to watch Netflix and I'm just going to enjoy that experience. Or I'm going to go sit on this park bench and just take a vacation from all of it, and giving yourself permission to put it all aside. Okay, so I'm going to share with you now just 2 last skills, and these are really important. They are more in the task of a doing and thinking. But one of them that's really helpful is pros and cons. Again, this is a simple technique. Most of us have probably done this at some point during some kind of decision-making process, but this can actually be incredibly helpful during distress. And one of the reasons is that during that high level of distress, that emotional part of our brain is firing so strongly that we're not really able to access the part of our brain that is able to evaluate and reason. It's not able to fully recognize consequences. So sitting down with a pad and a paper, using this kind of chart, which is a 4-quadrant chart where we are looking at the pros and cons of acting on crisis urges. And by crisis urges, I mean, those urges that are coming that could lead to things getting worse, short-term or long-term. So impulsive urges, giving up, avoiding, using a substance, etc. And we want to look at the pros and cons of using that, of acting on that crisis urge, and the pros and cons of resisting. And by doing this and sitting down with a pad and paper to look at this, it really does help to activate that part of the brain that allows us to think logically and to recognize these things. And when we're doing it, we want to just make sure that we're looking at short-term and long-term. We want to make sure that we're looking at times when the pain has ended. We want to make sure that we're looking at positive consequences. What is going to feel good when I make it through this situation, especially without doing something that will make the situation worse? And we really want to be honest about those negative consequences of not tolerating the distress. Another thing that can be helpful for pros and cons too is doing this ahead of time. So this kind of goes along with the coping ahead that I talked about earlier. Doing this ahead of time with some of those problem behaviors that you might be facing, those problematic ways of coping, have it ready for you. And then you can actually look at it during those situations when there is a high urge, and it can be easier to remember those reasons for not acting on it. And then lastly, I just want to give you a short word on urge management. So during a crisis situation, our urges can be very strong. Every emotion in general has an action urge that's tied to it. And a good part of that is biological, and that urge tends to be very, very intense during the distress. So when it comes to an urge, though, one of the most important things that we need to do is delay. Urges in general only last about 20 to 30 minutes, although they can feel like they're going to last forever unless we do something about it. But keep in mind that those urges only last 20 to 30 minutes, and it will eventually pass whether you act on it or not. And that is an important thing to remember. This urge will pass whether or not I act on it. And every time we do act on the urge, we strengthen the relationship between distress and acting on that urge. So it's important to really put in significant effort in delaying and avoiding acting on that urge. So this is kind of the general simplistic protocol when we talk about urge management. The first one is just to observe and describe the urge. It could be, for example, I have an urge to eat a pint of ice cream right now, right? And then what we want to do it non-judgmentally. This is not a time to beat yourself up. This is not a time to berate yourself, to judge yourself. We want to be effective. So the next thing we do is we simply set a timer, and we set the timer and we make the commitment not to act on the urge during that 15 minutes, right? So you could call this a 15-minute rule too, if you wanted. And while you're waiting, we want to do some of these skills that we talked about. So we can use the tip skill that we talked about earlier, distraction skills, self-soothe, pros and cons, improve. And then, after the emotional intensity has reduced a bit, then I put pros and cons before, but that's really where you're going to have more accessibility to really do the pros and cons more effectively. Now, after the timer is up, you want to go back and you just want to mindfully, non-judgmentally observe the urge. If the urge has reduced, go on with your day. However, keep in mind that you may need to go back and do some self-soothing or problem solving or deal with the situation that brought up the distress in the first place. With a lot of these skills, it may bring down the intensity, but then if we don't kind of reflect and deal with the situation that brought it up in the first place, it might just come back again. So that's important to remember. However, if the intensity is still high, you just repeat. You set that timer again for 15 minutes and you keep doing this until that urge has reduced, because remember, it will. Okay, so those are our skills. That's our presentation. So just to summarize, mental health matters, and it does have a far-reaching effect on physical health, performance, career, family life. And it's important that you reach out and seek help for those mental health challenges if they do arise. Seeking help, as Dahlia said, seeking help earlier rather than once there's a higher level of acuity tends to lead to easier and more effective, more promising treatment outcomes. But at any point, seek help. And we do have a lot of very effective evidence-based treatments for all of, the challenges that we discussed earlier. And, virtually every emotional challenge has some level of treatment, and help is available. And, finding an effective therapist, finding an effective mental health professional can be life-changing. And finally, finding the strategies that work for you, finding mental health strategies and coping strategies to make it through that high distress is essential, so that you don't encounter, future problems, you don't make the situation worse, and you don't strengthen, that distress linked to the problematic coping. And so now we have some time for a Q&A. I think we have about 7 minutes.
Thank you so much, Dr. Jones and Ms. McDonald. Really, the contact information is there. And just as a reminder, these materials will be able to be provided to you afterwards. You'll get an email. So we have 3 questions, and there's also a note from Carl Klein that there is another resource on the Florida Lawyers Helpline, which I mentioned, and you can get that phone number from the Florida Bar website by typing in mental health. So we have here, do you think attending therapy virtually is just as effective as attending in person? It seems like nowadays most therapists only offer remote sessions.
This is a great question, because things have really changed. I think especially post-COVID, COVID really shifted mental health in general and brought about more virtual therapy. So my simplistic answer is often virtual therapy can be as effective, but it also depends on what is being treated, and it depends on the person. So some people really do respond much more favorably to seeing the person and having that face-to-face contact. I also find that certain things, like if you're working through something, like serious trauma and things like that, that can often be best done in person as well. But in my experience, I see predominantly virtual now. I do, see people in person as well, but in my experience, the virtual therapy has been quite effective. But I think it also has to do with the person and my clients who, were not happy with the virtual experience, especially during COVID, now choose to come in person. So I think it really has to do with the individual.
All right. Thank you, Dr. Jones. The next question that we have is, what are some tips for daily well-being, improving mental health besides therapy or I'm adding my own, some of the coping mechanisms you listed? Which of those tips have you found to be most effective?
Do you want to take this one, Dahlia?
Sure. So I know that when people first hear this, they think it's kind of cheesy, but there's a lot of research that supports gratitude practices. I think that we go through our day where we're focused on what's wrong, what's not going well. And I think that taking periodic breaks to slow down and think about, okay, this is going well for me right now. These are the things that are, not a concern, and just shifting your focus to that throughout the day, that can be really helpful. Another thing is to make sure that you're trying to build in really small activities or practices that give you a pleasurable experience. And it should be something healthy, something that's giving you a sense of productivity, something that's just going to make you feel good about, something that you're doing. And again, this boils down to personal preference because we all enjoy different things. But I do believe that really kind of making sure that you're weaving in things that give you a little bit of pleasure throughout the day is very important.
I'd like to also add to that is that a couple of things that tend to be very helpful in general well-being too is learning how to be non-judgmental and understanding with yourself, learning how to self-validate emotion, basically just communicating. It makes sense that I'm feeling this way based on my history, my biology, or maybe anybody would feel this way, as opposed to, don't feel sad. This is stupid to feel sad. It's weak to feel sad. That doesn't change the fact that we're feeling sad. So learning how to just recognize that this is what I'm feeling and it's okay to feel that way is important. And then I think also learning how to be your own cheerleader and your own support. I think a lot of times we become desensitized to how harsh we are with ourselves. I think just because we spend every moment with ourselves, so we become, much more desensitized to that. So learning how to be, that supportive friend to ourselves is hugely helpful.
Well, thank you for that. We have one more question, although before we go to that, I just want to say that I have a sign above my door that says, there's always, always, always something to be thankful for. So I read that every day before I leave the house. So the last question is, how do you think COVID has impacted mental health? Have you noticed an increase in mental health issues after COVID isolation due to increased remote work, et cetera?
Do you want to take this, Dahlia?
Sure. So actually, prior to COVID, I know that research was starting to show that social isolation was one of the largest contributors to depression. And so I think that COVID just exacerbated all of that. Social isolation is just really, really difficult and takes a toll because human beings were not meant to be separated from one another. So I think that, yes, I think that COVID has really negatively impacted mental health across the board. And I know that, when Chris and I were working with clients, we had a lot of people that were moving throughout the US. So we tried to transfer them to different practices when they went out of state. And it was really hard. These practices were completely full, university settings. They were not able to offer therapy to their students because everyone was just at capacity. So yes, it definitely did. We saw a huge increase in mental health issues throughout the pandemic.
And I think also there's a spike in health anxiety too for people. With the isolation, obviously, like Dahlia was saying, has a huge negative impact, but I think there's also a spike in different kinds of concerns that people weren't struggling with as heavily before. And then I also think that there's such a higher use of virtual engagement in general. That's how people started communicating. And I think that high intensity, that high level of virtual working, socializing, all of that can have be detrimental to mental health as well.
Well, thank you both very, very much for today's presentation. And thank you to the Florida Bar Business Law section for launching this series. We look forward to hearing from you both in our future series and ask all of you who are attending to look for those emails with that information. So thank you very much again, and have a safe and wonderful rest of your day.
Thank you all. Once again, 6594 is the number. Have a great day.
Thank you.
Yeah.